I'm Dr. Goyal from the Jersey Bariatric Center. I'm frequently asked what's the right procedure for a patient from healthcare professionals and patients. There's a few factors to consider to decide which surgery is right for you. One is diet. The gastric bypass patients, because you have to reroute the intestines, you have to take multivitamins and proteins for the rest of your life. The band patients, you don't. Both procedures require lifestyle modifications and diet modifications. However, with the band, you need more commitment than the bypass, as there's no sensor involved to prevent you from eating unhealthy foods with the band. It only restricts the amount of food you eat at one sitting. The band is only restrictive. It does not cause you to have any malabsorption component or dumping syndrome. So with the bypass, if you're eating unhealthy foods such as high liquid calorie carbohydrates, you can get a dumping syndrome, what we call. And dumping syndrome is when you start having high heart rate, sweatiness, feeling really uncomfortable. So that's what happens with a bypass patient. With the band, all it does is prevent you from eating a lot of food at one sitting. Overall, with the bypass, you lose more weight. So with the bypass, you lose about 70 to 80% excess body weight, versus the band, you'll only lose about 50 to 60% excess body weight in 18 months. Finally, commitment is the most important part in making a decision which surgery is right for you. Band patients have to be more committed to eating healthy because there's no rerouting the intestines and they will absorb everything they're eating. So they have to eat healthy, they have to avoid liquid calories, they have to eat healthy foods, they have to avoid snacking between meals. And along with all those things, they have to exercise. So it's definitely a more involved procedure in terms of after the procedure. As opposed to the bypass, you can have the procedure and be committed to eating healthy, but not to the extent as the band. What we do is we help make their decision to what's best for them, what's the right decision for them. We don't like to tell patients what to pick because it's in the end, a patient is going to be living with that decision.